Welcome to Together San Diego, and thank you very much for joining us today. I'm Paola Hernandez-Jayo. Our guest today is Dr. Gabriel Wagner, infectious disease specialist at UC San Diego. He will be talking to us about STD, Sexually Transmitted Disease Awareness Month. April is STD Awareness Month. Welcome, Dr. Wagner. Thank you very much for joining us today. We appreciate it.
Hello. Thank you for having me, Paola.
Thank you for joining us, Doctor. STD and HIV are a very serious subject. Doctor, what effects has the COVID-19 pandemic had on STIs, which are sexually transmitted infections, here in the area in San Diego?
So, sexually transmitted infections, or as was previously called, sexually transmitted diseases, for short, I may just refer to them as STIs. So, STIs across the nation have been increasing. The rates of STIs across the nation over the last 5 years have been increasing steadily. And this is a trend that is present across the nation and across the state of California, and also particularly in San Diego. So in San Diego, and in the state of, and throughout the U.S., once the pandemic started, then rates dropped. And so you may remember when the pandemic first started and the first lockdowns happened over the first couple of months, people pretty much were staying indoors. And so we think that that what happened in the beginning of the pandemic is just that people did not have the opportunity to meet, and so there was less sex and therefore less STIs. What happened, what was observed later in the pandemic with reopenings, was that the rates began to climb again, and what we think is that the rates already look comparable to the previous year, and will probably be very similar or surpass them as more people start, engaging in sexual activity. And it's interesting because in the beginning of the pandemic, also as people were having less sex, there was also less availability of sexual health screenings and testing. So that compounded things too. And that also dropped the numbers. And that's probably why there was less reportable STIs. Things are changing now.
There's also, Doctor, a stigma that's tied to STI and HIVs. HIV is a human immunodeficiency virus. Why are these stigmas so harmful?
Correct. So there's stigma associated with STIs and HIV. HIV, for the most part, is a sexually transmitted infection as well. Stigma has been associated with HIV and STIs for a very long time. And even though we may now seem to be living in a more sex positive, friendly society, in many ways that's true, but in many ways it still has not reached all of the community and all of the households. And we still need more awareness around the topic, so that people can feel empowered to take sexual health into their own hands. The problem with stigma is that it hinders the person from reaching out, finding credible information, asking the right questions, and finding the right resources, and ultimately having the necessary sexual health screenings that they need.
So all of us could help, Doctor, to eradicate the stigma, you're saying, by becoming more educated on the subject and finding more information on the subject? Is that how we can help to eradicate the stigma?
Definitely. It would help to have to be more aware, to have more awareness, to educate ourselves more from credible sources. The internet is rife with anecdotes and sources that may be less than credible. And so it's important that when you do log online, that you look at county public health or public health resources. The California Department of Public Health has great resources. And finally, the CDC, which has fantastic resources, both for health professionals and for lay people. But also, I would say that it's important to simply have conversations around the topic, have frank and authentic conversations around the topic. And this can be with friends, with peers. It can even be with family. Telling someone frankly that you are on prevention treatment for HIV, something we call PrEP, and having an honest conversation about PrEP. Oh, well, why are you on PrEP? Well, this is why I'm on PrEP. I want to be more proactive about my sexual health, and I want to reduce my anxiety around getting HIV. And for those who are more sexually active, knowing the resources around you, and getting yourself tested frequently.
Also, doctor, in saying that, taking care of ourselves and getting ourselves tested, Dr. Wagner, why is it important to make sexual health part of our self-care, of a person's self-care routine?
Right. So I was touching on that a little bit. So it's important because it really should be incorporated into someone's routine as part of someone's overall health. So sexual health is the overall concept of well-being, social well-being, emotional well-being, uh, physical well-being, as it relates to someone's sexuality. And in the same way that you do are very careful about eye care, and in the same way that you are careful about dental care, by getting your teeth cleaned every year or every 6 months, in the same way one can incorporate better incorporate sexual health visits. If you are someone who has multiple sexual partners, for example, then perhaps every 3 month STI screening is more for you. If you are someone who is in a stable relationship, then perhaps one STI screening once yearly, or even less than that, might be better for you. And talking openly with your partner about screenings and safe sex in general.
Doctor, I shared some screens as we were speaking earlier about the statistics in San Diego and also I'm the country, I'm sorry, and also information on the cost impacted the healthcare industry impacted with STIs and also with HIV in San Diego. Does it vary around the county, the impact that it has, and which communities in San Diego are the most impacted by STIs and HIV?
Yeah, so STIs in general do vary by group. So certain groups are more affected than others. So gay and bisexual men have higher rates, and Black and Latinx communities also have higher rates. Now, I should say that these higher rates among Black and Latinx communities are not necessarily due to individual behavior, but probably more reflect a lack of access to quality sexual health screenings. And so there is a disproportionate burden of new infections among these groups, and also among younger folks. So between the ages of 16 and 24 is where we find the most number of new cases.
Doctor, you're talking about resources and getting tested. I know here in San Diego, you have something that is called Good to Go SD. Can you tell us a little bit about what Good to Go SD is, where people can find more information, where they can also go to get tested? And I'll also share the screen on the screen, the information that you sent me.
Right. So we have a program at UCSD, and it's located in Hillcrest, and it's the Good to Go Sexual Health Clinic, where individuals can come and get STI screening free of cost. And this is we do STIs health screenings for 6 different sexually transmitted infections. free of cost to the individual, and help link them to other resources as needed. The Good to Go Sexual Health Clinic is one option for folks living in Central San Diego. The County Public Health also is a good site, as well as Planned Parenthood and Family Health Centers.
Thank you, Doctor. And then just to close, I'm sharing your website, goodtogosd.com. I reviewed the website prior to this interview. There's a lot of helpful information. There's a lot of also frequently asked questions, replies to those. It lists all the resources and services. A lot of them are free. Could you tell us what Good to Go is or how people can access the information? I also shared the phone number. So the website is goodtogosd.com, and the phone number is 619-543-9340. Something else you'd like to add in regards to Good to Go SD?
Yeah, thanks. So it's there for the community to take advantage of. It's a great place to come and get all your sexual health needs taken care of in one place, and you're good to go.
Thank you very much, Doctor. I really appreciate the time that you spent with us, and I appreciate the time that all of you spent with us watching the segment today. For more information, again, you can go to goodtogosd.com. And I also want to remind you that you can watch more of these interviews on San Diego Union-Tribune.com/Together SD Live. And if you'd like to watch more of our live streams, you can go to San Diego Union-Tribune.com/UT Today. Thank you very much, Doctor. Always a pleasure to speak with you. Thank you for this information. And also thank you to Angela from your team for helping us to coordinate this interview. Have a wonderful day, Doctor.
Paola, thank you. You as well. And thank you, everyone.
And thank you, everybody, for watching.
News is more important today than ever before.
I'm currently outside Otay Mesa Detention Center.
I'm about to get a report at Sharp.
Out at Sunset Cliffs.
COVID testing site.
We live for these times when we're able to bring the news into the homes of people who need it the most.
I thank all of you for supporting our work.
When you subscribe to the paper, you're telling us that you believe in what we do.